Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. Here we have MR examination of the knee joint. This is sagittal T2 weighted sequence. This one is the coronal T2 weighted sequence, and here we have axial T2 weighted sequence. This patient had a history of total ACL transaction, and later on he had ACL grafting. Now this is post ACL graft. The patient has a history of knee instability even after surgery. Here we see this is posterior cruciate ligament, upper and mid portion, and here we can see this is the mid and lower portion of the PCL, or posterior cruciate ligament. So PCL is normal. This can be confirmed on coronal images. Lowermost portion and bony attachment of the PCL on tibia. This is the mid, and here we have the upper portion of the PCL. There is normal attachment on medial femoral condyle. Now here we see this is upper portion of a grafted ACL, but its mid and lower portion could not be visualized, suggesting graft failure. Here we can also see this on sagittal T2 weighted sequence. This one is the upper portion or femoral attachment of the grafted ACL, while we could not find its mid and lower portion, suggesting a total graft failure. Here we have low signal intensity area, which is basically displaced fragment of the medial meniscus favoring bucket handle tear. This is normal triangular low signal intensity lateral meniscus, and here we see very small portion of the body of the medial meniscus, and remaining of the medial meniscus is displaced near midline. Here we can see that medial meniscus main bulk is displaced medially. Part of the medial meniscus medially displaced. This is medial meniscus, and remaining portion of the medial meniscus could not be visualized over here. This is posterior most portion of the posterior horn of the medial meniscus. So we have seen an example of the total graft failure of the ACL with complex injury involving medial meniscus having bucket handle component. This one, and this is displaced fragment of the medial portion of medial meniscus, and here we can see part of the medial meniscus. This is the interior horn of the medial meniscus, while body and the posterior horn could not be clearly visualized, suggesting complex injury with bucket handle component, as this is the portion of the medial meniscus which is displaced near midline of the joint space, just above medial spine areas. Here we see lat meniscus, which is unremarkable, while quadriceps and patellar tendons are normal. Small amount of joint effusion is appreciated. We can see this is the suprapatellar bursa with joint effusion. Thank you very much. Assalamu alaikum warahmatullahi wabarakatuh.